Now, AI is changing how the healthcare system works globally in the world and in Nigeria. As a matter of fact, Nigerians are catching up slowly. Now, we have a doctor in the house today. We have Olawale Olabudu. Now, he's going to be talking about the emerging trends with AI in the health sector. We're super happy to have you in the studio. How you doing?
Yeah, I'm good. Good morning, Nigerians. The pleasure is mine.
Awesome. Now, when we have doctors in the studio, we always try to bring out notes so that we can learn a lot. Now, we're talking about AI in the health sector. It's quite interesting the amount of things that AI can do. As a matter of fact, apart from speeding up test results, apart from helping with lab data, apart from, reducing errors, human errors, there's so much. There are so many things that is happening with AI. But first of all, let us learn from you, based on your experience, how is AI helping with trends? What are the emerging trends that are happening with AI in Nigeria today?
Okay, well, thank you very much. Well, AI is the ability of computers and machines to do things that are typically done by the human intelligence. So it's like a step-down intelligence to computers and to machines. And it has really transformed the healthcare landscape, especially in the area of diagnosis. So it has helped to really use data and algorithms, to look at images, the laboratory, like hematology slides, your cytology slides, and all of that, to arrive at diagnosis. And it also helps in predictive analysis. It can look at some data that have been imputed and predict, what would happen to the health of a person in another 50 years to come. They can predict, pandemics, epidemics in a particular community based on certain data. So it has really tried, and it has, as you said, in terms of accuracy and efficiency. And one important thing that many of us can even relate with is the point of care. Point of care gadgets that we use. For example, BP measuring machines, sugar measuring machines. Many people, households have them today, and it's also based on set data and the effect of AI.
All right. It is clear that there are so many benefits with AI, but I would like you to just list out these benefits. What is it important? Because we are in a world where, like I said, we're trying to catch up with the global world when it comes to AI, but how and why is AI important? What are the benefits that comes with AI in the healthcare sector?
Okay, thank you. One major benefit, especially in the diagnostic area, laboratory medicine, it's accuracy. Because of the quality of data that have been set into it, so it's able to eliminate human errors and some other errors that could come. Then it also helps in efficiency. And when I talk about efficiency, not of the machine itself, but it helps healthcare workers to be able to concentrate on more complex activities, so that they can now relegate the routine activities, things they do on daily basis that just routine. They can now set that to the machines. Then, as I said earlier, point of care diagnosis is also key in this area.
All right. Now, I have some worries. When you say accuracy, how accurate can we trust AI? I'll give you a good example. The reason is because I woke up one morning one time and I had this serious back pain. I was feeling lower pain in for some reason, my lower back. So I had to bring out my phone. I went through an AI app and I was putting all the symptoms, all the signs, what I was feeling. And when I wrote everything, do you know that the results the AI gave was that I had cancer? And I was wondering, like, how will I have cancer from back pain? So I rushed to the hospital. I met a doctor, and I told the doctor that this was what AI actually told me: I have cancer. Now, the doctor actually said, no, it wasn't cancer. Asked some other questions, and I was able to really relate with my emotions and my feelings, and I explained certain things, and we had certain tests. So my question is, when we say AI is helping with accuracy, how accurate really? Because sometimes these little results that we get from AI could also lead to high BP based on the results we're getting. So how much can we really trust AI in today's world?
Okay, thank you. AI is accurate to the extent of the quality of the data that is set into it. So the quality of data would determine the accuracy of the output. As they say, that garbage in, garbage out. Okay, so depending on the type of AI that is being used, depending on the information that you put into it, and depending on the set data, okay, you know, and then another thing is the homogeneity of the data. And I'll give you an example too.
Okay.
For example, if a data is collated, maybe in America or in the UK, you know, how relevant is that data to us? Because in Africa,
okay,
because each community, each setting have their own peculiarities, okay? So if you are using something that is not developed in another place and which is not adapted, you know, to your own setting, then of course, you may not really get what you think you want to get. So,
sorry, my fear with that is when we begin to look at different tools and systems built globally, I am one who tries to you know, speak in support of Nigerian apps and Nigerian systems. But over time, we have realized that people would rather use global systems over home-based or homegrown systems because of certain issues. So how accurate would we actually say we would rather pick a homegrown system or a system created for Nigeria over a global system?
Okay. So, and that takes us to the point that, yes, as a local setting, because as they say that you think globally and you act locally. Okay, so we'll study whatever might have been achieved globally, so that won't mean that we'll be reinventing the wheel, but to now begin to now adapt them to us here. So if, for instance, they tell you that the sugar level of a normal person is between A and B, then we'll look at our own setting here that, okay, is it the same thing? If it's not, then we can now begin to adapt
make adjustments
and adjust accordingly.
All right, let's talk about limitations. We both agree that AI isn't perfect, and there are certain limitations that comes with using AI, especially the health sector. You know more about this. Please, you're more experienced as well. Just share with us some of these limitations that comes with AI. Okay,
yes. As I said earlier, that the AI is simulating human intelligence, okay? And then it works on data. So the quality of the data will also determine the outcome. That is one. Then AI is not innovative because it's a straight-jacketed, you know, system, you know, based on the inputs that it received, and then so it's not emotionally intelligent. It's not adaptive. It's not empathetic, so to speak, and it works just within the limit of the information that it has. So to that extent, it has a lot of limitations, okay? Then the explainability of it too. How is it, can it be explained to people, you know, to understand what it means at times? And that's why, I'll go back to that BP machine. You see, at times it also interacts, you know, it will tell you some things that, okay, you're about, you should, you know, remain calm, and then also want to tell you the result. And at the end of the day, it will tell you whether it is normal or it is deranged, okay? And I also want to say that for AI, and for us to get the best out of it, then we need to do it, you know, have our own local setting, understand it, and then put in our own data that are locally generated, you know, homegrown one, as it were.
All right, those are some of the limitations. But I just want to speak more about what the medical associations, what are they doing to ensure that this use of AI is properly done and used properly with for families and, you know, hospitals as well.
Okay, thank you very much. And number one, regulation. Okay.
Is there a body?
Yes, there is a body, and many bodies here in Nigeria, and the foremost of them is the Medical Laboratory Science Council of Nigeria. And then, as we speak, the 60th anniversary of the Association of Medical Laboratory Science of Nigeria is ongoing. Today is the opening ceremony at Welcome Center. Yes, and we are also discussing AI, as it were, sensitizing members, and then letting them to know the current trend globally and locally, and then how they can adapt that, you know, into patient-centered care, and especially the area of diagnosis. So the future of AI, you know, is here. You know, it's already here.
But who takes the fall? Who takes the fall for wrong AI interpretation? Is it the individual, the hospitals or the healthcare sector, or even the body? For example, what I mean is when we begin to interpret these things wrongly and then it affects our lives, who takes the fall?
Okay. Yes, that is where regulation comes in. And as I said, so we also need a lot of policies, regulatory framework to be able to put this in check. And you also agree with me that if as an individual you consult AI, it will also tell you its own limitation at the end of the information is given to you. And if it's on healthcare, I also advise you to see, you know, a healthcare provider in the field of your request or of your interrogation. So, and to that extent, if there is any error, and you take it that way, AI has exonerated itself, okay, by telling you that you need to see a healthcare provider.
That is how they say quality control. They say, please,
exactly.
I've told you what I
Assurance,
assurance and control.
Yeah.
Oh, that's brilliant. That is brilliant as well. There is a lot with AI, and I have also used AI, with my day-to-day work and all. But if there is one advice you probably give to people who generally just use AI or use apps that have AI infused in them, what is one health advice you probably just give? Yes,
AI is there, it is good, and then but it does not replace human intelligence. Okay, and that is to say that whatever it is, you still need those who are trained. The purpose of AI is to, one, give us global access. For example, I can be here and then I can get information abroad. I can seek information from people, that are not even in my own local area. So to that extent, I want to say that we should not think that AI, as I said earlier, it has its limitations, so it should not replace. And that is the assurance given to even people, professionals, in that field, healthcare space, that AI has not come to replace, their relevance, but it has only come to enhance and then give them room to do other things beyond the limits of AI. Okay.
All right. Thank you so much for being on the show. There is a lot that I've learned so far. Thank you for coming. Thank you for sharing your knowledge as well. It's been an amazing one.
Thank you.
Wow. And now for the doctors at home, for those that are worried, you've heard from someone who is way more experienced, and that AI is not here to take your job. AI is not here to cut short any of this, but to help enhance the job and enhance productivity as well. Thank you so much for being on the show. It's still Wake Up Nigeria. The show continues, guys. Do not go anywhere. We'll be right back after the short break.